But first, our big focus, the big story today, once again, a worry about COVID, given what we are seeing in China, where reports suggest between 1 million to 2 million people may end up losing their lives in the next couple of months. There's a huge surge in China. What does it mean for India? Tanushree joins us for the latest. Firstly, Tanushree, are we headed in India to a mask mandate?
Well, Vishnu, as of now, it looks like that we are not. The central government very categorically said that right now the situation is very much under control. In fact, 4 cases of BF7, as you rightly mentioned, which have been reported in India so far. Best part is in fact that 3 of those patients have completely recovered at home isolation. So somewhere the government is saying, though, health experts have been saying that this coronavirus, has no pattern whatsoever. But right now the health experts are saying that looks like our vaccines, our Indian vaccines, are very much working against this virus, which is now driving the surge of cases in China. So no, looks like as of now, fortunately enough, and let's hope so, that we are not heading towards a mask mandate. As of now, what the government is saying that they are advising people to mask up only in crowded places, and especially senior citizens and people with comorbidities, and the status quo has to be maintained as far as the flight restrictions are concerned. There is no ban on the flight on any international flight. There are no restrictions, no added new curbs which are put in place. Only the central government has advised people to mask up in crowded places. Rest of the states have been have been directed, in fact, by the central government to hold review meetings at a very regular interval. Also, the state governments, as we speak, Vishnu, Mr. Kejriwal is holding a review meeting in the national capital. So it's finally the states will be taking a call whether to make mask mandatory, whether to put any sort of curb in place. But from the central government, no such curb has been put in place. They have only advised people to mask up.
All right, thanks very much, Tanushree. I suspect that's a story we're going to be tracking very closely in the days ahead. Joining us now, Dr. Rajiv Dasgupta, who's a member of the COVID task force, Professor Srinath Reddy, Dr. Naresh Trehan, Dr. Peter Hotez, he's an American health scientist, and Minesh Pore, a resident of Shanghai, joins us as well. Dr. Dasgupta, is there a real concern that this variant, which is spreading, BA7, which is spreading across China, could have a big impact in India?
Thank you. It's unlikely to have a very big impact in terms of hospitalization or deaths, most likely. That's because we do have fairly high levels of immunity with a combination of natural infection, widespread natural infections, a lot of which would have been subclinical also, plus pretty high levels of vaccination coverage. What could be certainly possible risk groups are elderly or those with other comorbidity, but not vaccinated with a booster. We know that the booster uptake in our country is less, the third dose that is less than about 30%.
Right. And
that could be the sort of vulnerable chink in the armor that we may have, but that would be for very specific subgroups and not perhaps for the population in general.
Professor Srinath Reddy, is it time to reevaluate where India stands as far as boosters are concerned? And in the case of those who've actually done a third vaccine, is it time to actually move on to yet another booster? In other words, a second booster?
Well, we need to evaluate the evidence as it emerges as to how effective the boosters are. And secondly, we must also recognize that in India, apart from the 2 vaccine doses that people received, a very large proportion of the population also had been exposed to different versions of the virus itself. Mm-hmm. So they have had a natural infection, which also acted as a booster in the sense that the combination of natural infection as well as the vaccination produced hybrid immunity, some of which may be fading, but some of which would be very much evident in the form of T-cell immunity still. I would entirely agree that elderly people and people with comorbidities who are very vulnerable should ideally get an additional booster to protect. But a general mass booster immunization mandate at the moment appears unwarranted till we study the dynamics of the virus, what are the types of variants that are moving around, what is the level of morbidity and mortality they are producing, and particularly observing what our own experience is going to be.
Right.
We should keep everything on the ready, but not necessarily shoot from the hip at the moment.
Okay. Dr. Peter Hotez, what do we know about BA.7, this Omicron variant?
BF7, it's one of what I sometimes call one of the several Scrabble variants because they use high value Scrabble letters like B and Q and X and F, BQ1, BQ1.1, XBB, now BF7. And what you're seeing is different from previous waves. Previous waves, it was a single dominant variant. It was Alpha or it was Delta or it was Omicron BA1 or BA2. Now we're seeing kind of a hodgepodge of these variants in most areas of the world, and it's hard to predict which one's going to accelerate over the other. My feeling is that India does have some vulnerability while it has been relatively well vaccinated, and there has been some breakthrough infections and previous infections creating that hybrid immunity. I think with these new Scrabble variants, unless you're boosted, there is going to be some hospitalizations if there's and worse if there's a surge. So I think that's what we really need to look at is next generation boosting that includes something against BA5 and its subvariants. So for instance, we collaborated with Biological E to help produce Corbevax, and now we're looking at the bivalent booster version of that with them.
All right. Dr. Trehan, what about other vaccines? For example, nasal vaccines. Bharat Biotech has come out with that. There are other groups which are also... Is that an easy solution if you're looking for an interim booster beyond what people have received?
So certainly the new vaccines, if they are designed what we call bivalent vaccines, and they are actually effective against some of these variants that are raising their head around the world. Of course, it will be very convenient and very helpful. The question basically is, it's not been used enough, and we don't have enough field data to say whether it's going to be effective or not. So I think that there are several measures we need to take right now. First of all, we should take this China experience seriously, because we paid a very heavy price the last time where we thought, it spread around the world, it hadn't come to India, there was a 2-month lag. So I think that we have to be very alert and watchful and say, what are the measures that we took the last time? And in a calibrated manner, as the evidence emerges, we should be able to escalate our defense mechanisms. So one of the things that we are talking about is boosting, and the boosting itself, we don't know how effective it is going to be against BF7 or other variants. There are 10 variants floating around the world. But I think that we should watch it very carefully and then put the measures in, especially now international travel is one big thing. That's how it happened the last time. And maybe we should put the alert on that look out for symptoms on anybody who's coming from anywhere in the world, and then check them at the airport, not necessarily testing them right now. Second thing is to make the public aware of the fact that, look, it's a real danger which is spreading not only in China, it is in Japan and in some European countries, it's in US. And the numbers you look at these countries are not small.
No, not at all.
So I don't think that we should be complacent, but at the same time, like the government has said, you do any detection of BF7 or other variants, you do the genome sequencing to know what the nature of the animal is and what graduated response we need to make towards that.
Minesh Pore, a resident of Shanghai, also with us. Minesh, could you give us an idea of what you've been seeing around you in a city as large as Shanghai? Is it genuinely as bad as it seems to be?
Yeah, frankly speaking, the situation is that every second person that we talk to has the infection. Today I was driving at peak hour at 9 o'clock in the morning, and basically the streets are empty, and you can tell that people are staying inside, people don't want to go out and try to get infected. So yes, the effect is real. You can see it with the deliveries. The delivery guys were pretty regular, and now the deliveries are getting delayed. You order food, it's getting delayed. The simple deliveries of necessities are getting delayed. So you can see that there is an impact. Airports are relatively empty. Railway stations are relatively empty. So yes, there is overall an impact of that. There is lines at the hospitals, not crazy lines, but you can see some lines at the hospitals too. So yeah, there is an impact, and nobody expected that as soon as China let go of its regulations, that we would have so many infections. It feels like in the last 2 years or so, we kept everything closed up, and people did not get any immunity to any outside. Like India, everybody got immunized because, like somebody was saying, with the local variants, and that never happened for
Right.
China.
Which
We are
brings me,
coming
Minesh, to
into
my next question. Do you believe that you are getting enough information on how bad the situation actually is?
I mean, in China, there is always going to be some information you're not going to get. But what I would say is the information that is necessary for me to take care of myself and my family as to what needs to be done if we get infected or if we need some vaccination, if we need medication. I think we're getting that information, at least in big cities like Shanghai, that information is available. It might be different in rural areas. It might be difficult in some parts of the country, but at least I don't think that's an issue in big cities.
Okay. Dr. Hotez, air travel around the world from China, obviously. Do we now need to get desperate? Should it be shut down? Or is it too late?
Well, I've not been very impressed with the impact of air travel. For instance, at the start of the pandemic, we put a lot of emphasis on shutting down air travel from China, and by then the virus had entered New York City surreptitiously from Southern Europe, and it was the pandemic had already started in the United States. And so far, the track record of travel restrictions, unless you're in very isolated island areas, has not been very successful. So on that, I don't know the particular situation between China and India, but that's generally speaking, no, I've not seen benefits of travel restrictions, more of a downside.
Dr. Dasgupta, your view of what's happening in China, and my specific question is this. Is there a sense, and I know that China has faced some certain challenges in terms of vaccination, but do you believe that it is the quality of the vaccines themselves, which one needs to look at carefully? Are they as efficacious as, for example, Covaxin or Covishield, which most Indians have received?
I think what the Omicron experience bears out, as far as the Indian situation goes, is that the vaccines we have used have been pretty effective, with the caveat that we also had pretty high natural infection rates. But what's very specifically important about BF7 and some of the newer variants emerging is that they do have pretty high immune escape properties, even in the face of those who have received 3 doses of vaccine plus had a natural infection. But again, whether that will translate into very catastrophic outcomes as far as India goes, unlikely, because we are not as relatively immune naive as the Chinese population is, which unfortunately is an outcome of a very stringent zero COVID, followed by the dynamic zero COVID, and then the final relaxation coming in the first week of December. That really is the sequence of events, or the sequence of strategies rather, in China, which is not really the case for India.
Dr. Reddy, let's talk about the science of BA7 itself. We faced our own horror stories in India with Delta, and we saw the millions of people in our country who lost their lives. Is BA7 different in its design? Is it different in the clinical outcomes in patients?
Well, there are 3 things that you must look at any virus or a variant. Is it more infective? Is it more capable of escaping immunity, whether vaccine acquired or acquired through a natural infection? And third, most important of all, is it very virulent in terms of producing severe illness and very adverse outcomes like hospitalization and intensive care and death? So far, Omicron globally has been reported to have relatively milder or less lethal outcomes than the Delta variant. Now, is that because of protection offered by vaccination or by natural infection? or the virus itself has adapted in order to coexist with us without decimating the human population? Those are questions that we need to answer. However, whatever studies have been done show that penetration deeper into the lungs, into the lower respiratory tract, is not very high with different members of the Omicron family. So all that we can say is at the moment, evidence suggests that Omicron is not likely to be as lethal as Delta. However, in a population like China, where there has been really no major exposure to the virus in its natural form, where there are large number of elderly people who are unvaccinated, where hypertension and diabetes rates are very high, there is a huge vulnerable segment of that large population which still could have adverse health outcomes. That may not necessarily be reflected in the Indian situation.
Right.
But we still have to keep a watch on what is happening to the rates of hospitalization and death in China, and also see how our own cases are behaving. But the global experience is that Omicron's family behaves differently than Delta.
You know, Dr. Trehan, it's perhaps it's time for a lot of us, myself included, and as you know, we've done actually more than 100 programs over the last few years, so many with you, and we criticized the entire concept of herd immunity. We said that every single life is important, and therefore it's not enough to say let's get everybody natural immunity, and those who survive will, and those who perish will unfortunately perish. A lot of us felt that that was not the way. A lot of us felt that perhaps we needed to do more lockdowns, or something else needed to be done to distance people from each other. But the government actually decided that this policy of being relatively open from the onset, other than a couple of lockdowns, was the way forward. Do you believe that, you know, in hindsight, despite the fact that we did lose as many people as we did, that it's that experience which might end up saving the lives of many more at this juncture?
So, you know, there were many lessons learned, Vishnu, from the last wave, especially in the Delta. And then now, you know, you look at it that traditionally or historically, viruses, when they mutate, they become milder. They lose their virulence, although they may increase their infectivity. So more and more people would get infected, and we have seen that very clearly in the Omicron wave. Today, I don't think that there are any or very, very few patients in the hospital today in the whole country, although Omicron did affect a lot of people. So we are hoping that it follows the historical event that all the mutations that follow may spread easily, but will be less virulent. Now,
Right.
One of the things that I really want to caution in this whole thing is that let us not discount this virus. We know very little about it. We are only going by our experience. And if we are watchful and we see any indication that there are spreads even in small pockets, we must then react very quickly. We
Right.
have the means to it, we have the experience, and we have the infrastructure for it now.
Yep.
So I think that, one, there is no need to panic right now, but it needs to be extremely watchful. And the government is putting some measures in already. Now, whether international travel, you want to do random checking, because what we had done was we had escalated in a manner, and then we de-escalated in a manner.
Yes.
So that we were quite successful in containing after the bad experience of the Delta wave.
Sure.
And I think that it is true that all the factors may play a role, that we have immunity, we have the vaccines which are effective, boosters to some degree, but we still need to be watchful, especially for the older and vulnerable population.
Right.
Don't go in crowded places without a mask. Do not say the mask is something of the past. Whenever you are doing some activities, like even maybe in flights, for your own protection, the government doesn't have to protect you. You can protect your own self by common sense.
Yep.
If you want to go see a movie, by all means do it, but you'll be sitting for 3 hours in a movie hall with 1,000 people. Yes, maybe you should mask at that time. So
Right.
avoid unnecessary crowds, avoid going to vulnerable places, and see what happens in the near future. We will get some idea in the next few weeks which way we are going.
So, Dr. Dasgupta, that really does bring me to my last question. And it's this, you rightly mentioned that there's a lot more to be done in India when it comes to boosting our population. We have an imminent threat upon us. We don't know if it's going to be good, bad, or ugly. In a situation like this, isn't it time to roll out boosters much more aggressively? Haven't we learned from the mistake perhaps that we made the first time around, before Delta actually hit us, by delaying the rollout of vaccines or not having it out in the same pace as some other countries? If we have the benefit of time now, why aren't we talking about rolling out vaccines, as in the booster, right away, as in let's buy and roll out, because we don't know, it might end up saving lives?
Well, while vaccines or the availability of vaccines generate a whole lot of optimism, vaccination in a program or campaign mode is a much tougher game, and it can't really be switched off and switched on overnight, quite literally. At the same time, India does have extremely strong fundamentals of the immunization program, and that's what has really served us well. What we need at this point to increase the uptake of boosters are very novel communication strategies and social mobilization strategies. If you rely simply on the scare factor, that's going to last for a relatively short while, unless we are really smart and clever about communication and social mobilization. The second thing, as all of us have been saying, that now that capacities are much stronger, the role of the local in terms of district or the urban local bodies, the role of the local today is much stronger in terms of quality surveillance. And if we are not really putting our heart into quality surveillance, then we are going to miss the red flags.
Right.
But yes, boostering is certainly possible.
No, but and I think that point you mentioned, that you were talking about immunity, but it's almost as if people are immune to be scared of COVID. It's become such a part of our lives. How do you actually get people to take boosters which are available in India? It really does need something smart and some sort of smart messaging, because who knows how many lives that might end up saving. Look, gentlemen, I suspect we'll be back here talking about this, and that's sad. We were living through a relative period of calm as far as COVID is concerned in India, but let's hope that we don't face too many bad consequences. But I think I take that message of, being smart, wearing masks when required, as the lesson perhaps of this program, speaking to some of our finest experts there.